A Western Mass News viewer reached out to our newsroom with questions about COVID antibody testing, which we took to a local doctor.
Western Mass News reporter Amanda Callahan is getting us answers.
The antibody basically is a natural substance produced by antibody to basically neutralize the virus. And so it can be elicited by either vaccination or natural infection.
A Western Mass News viewer who had COVID back in January says they are still testing positive for antibodies. And while this is the case, they're still being urged to get a booster shot. They reached out to our newsroom confused about the difference between natural immunity and immunization. And they're wondering who actually needs to be vaccinated. So Western Mass News took their questions straight to Bay State's Chief of Infectious Diseases, Dr. Armando Paez.
As it stands, as soon as you recover, you can still benefit from it. But we don't know the exact answer, will you actually need it or not, because you actually have a third exposure to the virus, and you may actually elicit, a response again and may not need the booster shot.
Dr. Paez says there are different types of antibody testing that can be done, but antibodies that come from COVID vaccines and vaccine boosters are easier to track and predict than those that are naturally produced.
There's one that's semi-quantitative, which means they try to quantitate the level. Some are qualitative, meaning there's presence of antibody and there's not. The antibody waning, we know that it's about 6 months as opposed to some natural infection, depending on how severe the infection is, by 2 months, the level of neutralizing antibodies go down to a level that's not detectable by testing.
Antibodies can typically be detected 1 to 2 weeks after recovering from COVID. But Dr. Paez says that can differ from patient to patient.
For natural infection, as I mentioned, it depends. It's a spectrum, right? Because there are mild infections in individuals who actually didn't have a lot of virus in the nasopharynx and didn't really react to the infection, may not really actually develop enough antibodies.
Dr. Paez says it's important to remember that recommendations can and most likely will change as medical experts continue to learn more about the virus. Reporting in Springfield, Amanda Callahan, Western Mass News.